You're listening to Talk with Audrey. With the spread of COVID-19, the dental profession is doing its part to mitigate the spread of coronavirus by postponing non-emergency dental procedures. But what should you do if you have a true dental emergency, and what constitutes a dental emergency, and where to go so that, if you're in trouble, well, you know where to go. What can I tell you? Joining me, Dr. Alan Gluskin. He's president of the American Association of Endodontists. Welcome.
Thank you, Audrey. I'm delighted to be here and inform your audience a little bit about a dental emergency in this time of the COVID virus. Endodontists are root canal specialists, and people hear the word root canal and they just shudder because they hear stories, and that's human nature to recite stories that aren't nice. There are thousands and thousands of root canal procedures performed by specialists who understand pain control, who understand the complexities of the teeth they're treating, and who understand how to work on those teeth in order to do it right and have it safe for your natural lifetime. So an endodontist is a root canal specialist, and patients who are in trouble now, 85% of endodontic offices are open to treat dental emergencies. So if you're having a toothache and you need expert help, you can go to the website findmyendodontist.com, findmyendodontist.com, and you will do a search of your zip code, and you will find a specialist who can handle your tooth pain or swelling and resolve and save your natural tooth. Findmyendodontist.com is your answer if you're having a toothache and your dentist's office is not open.
Well, so the difference then between a dentist and the endodontist, because most people would call their dentist, right, and say, "Hey, I have this problem." So, what's the difference between your dentist that you see for your regular treatments versus the endodontist?
All right, and that's a wonderful question. All dentists are allowed to do root canals, and many general dentists can do them, but some of the back teeth especially get very, very complicated. And an endodontist is a trained specialist who goes to school for 2 to 3 years additionally. Their technology that endodontists use is as good as it can be anywhere in the world, because we all use microscopes so we can look down inside teeth at 20 times the magnification to be able to see the intricacies of what's going on inside the tooth. We use three-dimensional imaging and x-rays so that we can see how complex a root canal might be, and we are experts in pain control because so many of the patient clientele that we see are in pain when they come to us. So learning and understanding how to do painless dentistry, especially when you're doing a root canal, is extremely important. And if you are so inclined to self-refer or have your dentist refer to an endodontist, you will be very pleased by the way you are treated and how the endodontist handles your pain.
Yeah, I actually had a root canal years ago, and I remember being scared to death because you hear it's going to be painful, it's going to be this, it's going to be that. My dentist actually referred me to an endodontist, and I was like, when I got there, I was like, oh, okay, this is all right. I mean, it wasn't this big boogeyman that I had imagined in my head, and sort of sitting there and having this procedure done and being in a lot of pain. So yeah, thank you for that. And people have their fears around going to see the dentist anyway, and if you have a dental emergency, you're on edge even more in anticipation of the procedure.
The most important thing about that particular procedure is, Audrey, you don't want it done twice, okay? And so if you worry that your dentist may not have the skill to do a complicated molar in the back of your tooth or another tooth that you might believe is difficult, you absolutely only want it done once, and you have your best chance to never having had to do it again if you use the skills of an endodontist.
Right, which is why we're talking. I mean, a lot of folks don't know to ask to see an endodontist, right?
I agree.
Yeah.
And this is Save Your Tooth Month, so we are getting out there and trying to advertise the skill and expertise of root canal specialists that are endodontists.
Cool. So now, what constitutes a dental emergency?
Well, when you're woken up at night out of a sound sleep with a toothache, that's a dental emergency. Your body is trying to remove the inflammation that's going on inside the tooth, and it's just literally you can feel your heart pounding in that jaw. If your face starts to swell and it's related to a tooth infection, you need an endodontist, all right? And endodontists are trained to deal with these kind of emergencies in the most expedient and painless way. So when you recognize that all of a sudden you can have a cold drink and your tooth aches for 10 minutes afterwards, you need an endodontist.
All right. What about maintaining proper oral health practices at home?
Well, we're all in this together, and we all need to brush our teeth in the same way. And the science is that you should brush your teeth when you first wake up in the morning before you eat breakfast, because you want to clean that bacterial colonies and plaque off your teeth and disrupt it first thing in the morning. You also want to do it before you go to bed at night so it can't proliferate while you're sleeping. And if you have a chance and you've eaten during the day, it's always great to do brushing a third time. And floss and little applicators that you can put between your teeth to scrub them are always helpful. And if you don't have a chance to brush in the middle of the day, a mouthwash with fluoride is always very efficacious. You need to clean your teeth so you can keep your health, and oral health is extremely important to your overall health.
And the other thing I think that's also important is really trying to keep your own natural teeth, as you age, too.
It couldn't be any more important. We believe that saving your natural tooth is a key to having health in your old age. I mean, teeth weren't meant to last that long. When you look at Homo sapien as he evolved from lesser forms, I mean, they only lived to age 25 or 30 years. So our teeth need to be protected, and we need to take good care of them because we're living into the 6th, 7th, 8th, 9th decade of life, and we need to protect our teeth for that very reason.
Let's talk about the toothbrush, because, of course, we all use that to brush our teeth. How do you take care of your toothbrush so that you're not sort of, reintroducing germs from the last brushing, if you will?
Well, that's a great comment. First of all, how you take care of your toothbrush is to get a new one every 90 days. 3-4 months is maximum time for a toothbrush. When you see those bristles not standing straight anymore and they're all bent over, and I've seen plenty of very used toothbrushes, it's time for a new one. I mean, you're buying a toothbrush to do a particular job, and if you can't do that job well, you need a new toothbrush. So rinsing your toothbrush, first of all, washing your hands before you brush your teeth is smart, because if you touch things and then they go into your mouth, especially in this era of COVID virus, you're exposing your own self. And then washing your hands after you brush to protect your family and your friends is important. But using a good toothbrush that's fairly new, at least 90 to 120 days new, and using it properly is really important for good oral health.
We have about 30 seconds left. What's better, just a regular toothbrush or an electric?
They're both good. If you have the skill to use a regular toothbrush, that's fine. Electric toothbrushes are a good alternative, and you should let your toothbrush dry out in a safe place so it doesn't get contaminated by others, and definitely try and use it twice a day. You'll never regret it.
All right. My guest has been Dr. Alan Gluskin. We've been talking about dental emergencies and how to care for your teeth during this time of COVID and going forward as well. Thanks so much for joining me, Dr. Gluskin.
Thank you, Audrey. I appreciate it.
It's my pleasure. And don't forget, if you got a toothbrush, you don't use it, it's no good.